Hello everyone. Today we are going to discuss about one of the common GI disorder called gastroesophageal reflux disease or GERD. About 1 in 6 adult Canadians are affected by GERD. It is a chronic condition that affects the GI system in which the stomach acid frequently flows up to the esophagus, causing heartburn. Before we go further, did you know that wearing tight clothes increases the risk of GERD? Etiology: a normal lower esophageal sphincter or LES blocks the stomach acid from going up to the esophagus, but factors like LES dysfunction, hiatal hernia, and LES relaxation can lead to GERD. Now let's discuss about the pathophysiology of GERD. After chewed food reaches stomach, it begins to digest with the help of stomach acid. In GERD, this stomach acid goes up to the esophagus due to relaxation of the LES, thus irritating the esophageal lining, leading to GERD. Some of the common signs and symptoms of GERD are heartburn, usually after food at night, chest pain, difficulty swallowing, regurgitation of food, sensation of lump in throat due to dryness, bad breath, vomiting, and flatulence. Did you know people with asthma are at higher risk of having GERD as the flare-up can relax the LES? When to see the doctor: if you experience chest pain with SOB and jaw and arm pain, if you have severe GERD symptoms at least twice a week, or take OTC medication for heartburn twice a week, you should definitely go see a doctor.
Causes of GERD. GERD is caused by frequent acid reflux. If the sphincter relaxes abnormally or weakens, stomach acid can flow back up into the esophagus. The constant backwash of acid irritates the lining of the esophagus, often causing it to become inflamed. There are risk factors and there are aggravating factors of GERD. One of the risk factors is obesity. Hiatal hernia is one of the risk factors. Pregnancy is one of the risk factors. Connective tissue disorders such as scleroderma, one of the risk factors. And delayed stomach eating. They are factors that can cause GERD in an average human being. There are aggravating factors to GERD. Smoking is the big one. Smoking, alcohol intake, and coffee drinking. There are aggravating factors to GERD. Eating late into the night and eating large meat. They are aggravating factors. Fatty foods or fried foods, they are things that can cause you to have GERD. And aspirin also can make you to have GERD. There are some complications that can happen when you have GERD. One of them is narrowing of the esophagus. The esophagus is damaged to the lower esophagus from stomach acid, which causes scar tissue. And there can be an open sore in the esophagus. And there can be precarious changes to the esophagus also. These others can lead. Diagnostic testing is in two parts. We have the subjective and we have the objective. The subjective is when your doctor begins to ask a question about how you're feeling and for her to be able to establish if you actually have GERD. But there are some objective diagnosis that will actually confirm, like upper endoscopy, ambulatory acid. Also, your doctor can do esophageal manometry on you. Your doctor can also carry on X-ray of the upper digestive system just to be able to establish if you have GERD. And there could be barium radiography done on you and just to establish the fact that GERD is actually present. Before you go for your appointment, note any stressor or change in lifestyle. Make a list of all medications, including supplements that you're taking. And also write down any triggers to your symptoms, e.g. food that you eat. Write down your symptoms, including any that seems so unrelated, just for your doctor to be able to know what to do.
A special procedure for treating GERD is fundoplication. It involves tightening and reinforcing the LES by wrapping the stomach around the outside of the lower esophagus, and it can be done through a long incision in the stomach or laparoscopically. Another special procedure for GERD is the Stretta procedure. It involves a thin flexible tube with an electrode at the end being inserted into the esophagus. The electrode heats up the esophageal tissue, creating tiny cuts that will form scar tissue, and that helps to strengthen the surrounding muscle. Link surgery is another special procedure, and LINX is the name of the device. It's a ring of tiny magnetic titanium beads that wrap around the LES to strengthen it. The beads are magnetized so they move together to keep the opening between the stomach and esophagus closed. but food can still pass through. Before any special procedures are considered, dietary changes and medications will be recommended. Some examples of medications are antacids and H2 receptor antagonists, for example, Zantac, and proton pump inhibitors, for example, Prevacid and Nexium. A nursing diagnosis for GERD is acute pain related to reflux of stomach acid, as evidenced by patient complains of pain in chest due to heartburn. Some interventions are to help the patient find a comfortable position and assess location, duration, onset, and intensity of pain to rule out angina. Another nursing diagnosis is deficient knowledge related to patient lacks information about disease process and management, as evidenced by patient is unable to manage preventable issues. Some interventions are to teach patients about medications and dietary changes, and to provide information about disease process. A special consideration for GERD is the elderly population. They can develop pulmonary complications due to aspiration of refluxed material. Their symptoms of GERD can also be very similar to that of angina pectoris, and they can develop issues with their eyes, ears, nose, and throat.
Now we are going to discuss 3 interesting facts on GERD. Fact number 1. People with asthma has higher risk of having GERD. It is because asthma flare-ups can cause relaxation of the lower esophageal sphincter. Fact number 2. Wearing tight clothes can increase the risk of GERD because it can lead to regurgitation of food. Fact number 3. GERD can affect your voice box, windpipe, and even lungs. Thank you.